welcome back to another episode of the Deals for Dentists podcast. I'm your host, Dr. Eric Block. Through these podcast episodes, I'll be interviewing dental professionals and companies and aim to inspire, entertain, and educate you on the best tools and technologies out there. My goal is to help make your practice and career more profitable, efficient, and most importantly, more enjoyable. Today, we are joined by Dr. Warda Inam, the CEO of Overjet. And you can go to dealsfordentist.com and they're offering a 10% discount for anyone wanting to use Overjet Dental Assist. So Warda, thanks so much for joining us.
Well, thank you, Eric, for having me.
So Warda, tell me all about Overjet and how you can help dentists.
So Overjet is a company focused on utilizing artificial intelligence to help dentists in their diagnosis, as well as helping them perform the care that they want to perform. So in general, what artificial intelligence is a technology that helps assist in the same cognitive abilities that dentists are utilizing every day when it comes to making a diagnosis or reading dental data. Overjet technology can read that similar to how a dentist would, and then assist them in making decisions and making better recommendations to the patients. And then also when it comes to making these recommendations, you have now visualizations on top of the x-rays or the dental data that is present to assist in the treatment acceptance as well. So it's a way of communicating better with the patient and making better decisions.
Okay. So Overjet, this is artificial intelligence, correct? And it helps assist the dentist almost like a second opinion with their x-rays. Is that right?
I don't think of it as a second opinion, primarily because I don't think dentists need a second opinion. I think it helps them in making, assisting them in their diagnosis as well. So similar to how a hygienist, when a dentist walks in, a hygienist points out things that the dentist should look at because they are very, very busy. I think this is a technology that does that. It highlights everything that the dentist should focus on, and then other things that they, so that nothing gets missed in this very busy schedule. So I think of it as an assistive technology, similarly to how dentists are is assisted by hygienists or assistants in making their treatments better, their diagnosis more effective.
Yeah, that's a good point. So it's what I call with the hygienist, we call it a co-diagnosis. So they make a diagnosis, then I come in and either confirm or determine the final diagnosis, but it's a co-diagnosis. So this is actually like just another thing that's there helping us and assisting us with diagnosis. And no, you mentioned the word missed. And how often do dentists miss something that the artificial intelligence will pick up?
Yeah, so I think most people think that dentists just if you asked around that do dentists overdiagnose or do they miss? Most people will say dentists overdiagnose, and that's not just the reality that we see. Where there is a lot of treatments that are getting missed, and they're getting missed again because it's a very, very busy environment. If you just think about, if don't think of it as a dental clinic, any other environment where you had to look at say 18 x-rays and give recommendations, what would happen more? Would you be able to give a very comprehensive diagnosis with everything being highlighted, or were there chances of things falling through the cracks? And I think that's what we see when we install the software, where there is, of course, the large lesions do not get missed usually. However, periodontal disease gets missed. Other conditions might fall through the cracks here. And having a technology that can highlight everything, so the dentist, as they walk in, everything is ready for them, and they can make the best decision, is, I think, very, very needed in the busy environment that that dentists have to practice in.
Oh yeah, you can get so busy, and especially like Dr. Blocky here. 8 a.m. I'm fresh in the morning, and I look at a set of X-rays, and then Blocky gets tired around 5 o'clock. I just seen a whole day full of patients, my diagnosis of the exact same set of x-rays could be totally different in the morning versus the afternoon, right?
That's also there, but also think about it, Eric. Like, you guys don't realize this, like the fact that you're actually doing an operation while you have to get up. You're focused on doing an operation. You have to get up, change the operatory, get into another. The lighting situation is very different as well. It's a very bright environment, which is not the perfect environment to be looking at X-rays. You have to look at these X-rays, not only understand them, diagnose on it, but also communicate that with the patient in such a way that they not only understand, but also accept the treatments. And then you need to go back and start doing the operation again. So I think that's, the actual environment that dentists are operating in, and where the diagnosis is happening, and which is a very, very little amount of time to actually, if you did not have that situation, you would think, you would probably sit down, grab a cup of coffee, have your time, spend time doing the diagnosis, and that would be then the environment itself. So not only just the time difference, but also how tired you are, but also the lighting is actually very, very important, because your pupils are dilating and contracting, etc. And the environment it's as well, where you there's a patient in that operatory probably waiting on you to let them know. So it's a very interesting environment that dentists operate in, and I think people have just gotten used to it. So it isn't strange, but as an outsider, when you look into the industry, it's amazing what dentists are able to do in the limited amount of time, and also juggling surgeries, operations, etc., and making the diagnosis in the same hour block.
I'm exhausted just listening to that. I mean, you're so right. I mean, it's different if, let's say, you just have a scratch office, you just opened up, you just getting one or two patients in the chair in a day. You have so much time to sit with that patient, but ultimately our goal is to get busier and then start to hire hygienists and more hygienists, and then more doctors, more associates, and it just becomes this machine, and it gets busier and busier. And if you're not careful, you can miss a lot of things. Because you're right, there's so much that goes on in a dentist's day-to-day life. And then there's the psychological aspect of it, where if I have a patient that's very phobic and they're saying, please don't, block, Dr. Block, don't find anything. What are you looking at? You're looking at those x-rays, you're going to find something. Then that starts to creep in. It becomes this whole psychological thing where I could say, oh, okay, yeah, everything looks good, we'll just check you next time. But meanwhile, I may have missed something. So there's that psychological component too. But the artificial intelligence will be there to kind of guide us and highlight everything so we don't miss anything, correct?
Absolutely. And then, it's on the dentist of doing they have the most amount of knowledge. There's also intuition. There's also other things that go into play. Like I've had for my own diagnosis as well, where it's like, okay, the x-ray, I'm not quite sure, but I, just by my experience, etc., I have seen, and with that, they've been right as well. So I think with that, the idea here is where they're being assisted in having all the information, and now they're in control to make the right decision for the patient, and having the patient involved in those decisions as well, so that they can understand. Right now you have a black, white, gray image that most people don't understand. When I was not in this field, when a dentist would tell me, hey, do you see radiolucency? First, I don't know what radiolucency meant, but also there's like some spot, a darker spot, but I see darker spots everywhere. I don't know whether that pulp is a darker spot or whether it's a carious lesion. Oh, it has to come from the enamel. I don't know what an enamel is. So I think this patients themselves aren't educated on x-rays and teeth, etc. And the fact that the dentist has to now explain all this information to the patient in such a way that they're informed enough to make the right decisions for themselves is a big task on itself. So being able to have technology that can support the dentist in that communication, not everybody needs to be the most amazing communicator if they're a great dentist, right? But now currently you do, because a patient, if they don't understand, they're not going to accept the treatments as well, which are in their best interest. So these are medically necessary treatments that need to happen. So having technology that helps dentists better communicate with the patient, I think is a whole field on its own and needs more work, so that in the end, the treatment acceptance rate should not be in the 60-70% mark that on average you hear they are. They need to be much higher. And for us to provide technology for dentists to better communicate is, I think, extremely important for improved patient care.
Oh, I mean, you could be the best dentist in the world, but if you can't communicate with the patient and get the patient to agree to your treatment and say yes, then it's all for nothing. And especially a dentist coming right out of school, they don't teach you any of this communication in school. In fact, the communication while you're working on a patient in school is like the patient's not even there. It's like you're talking over the patient and about the patient, not to the patient. So you learn your clinical skills, but you don't learn anything about patient education or communication. So for a young dentist coming out, having all the help you can get to support your treatment is huge. And also a new hygienist coming out of school, whether they're just coming out of school or whether they're new to a practice. It's a new environment, so we can get all the help that we can get. So Warda, how did you come up with the concept of Overjet? How did this whole thing start?
So for me, it actually started very personally when I changed my dentist. I went to a new dentist. I got a treatment plan, which was very different than before. And like most patients, for me, it was, okay, first, I got very, very worried of what is all wrong. However, what I realized was that, and most patients do this, is whoever's telling you less is probably right. Right. And the idea here is, of course, it's not in their best interest to be telling you, that you have nothing wrong. So they must be, the one who's telling you that must be right. But I do not, what I did not realize, and I think most patients don't realize, is complexity of diagnosis, and which is not as simple as X and Y. It all matters in terms of other conditions that you might have, what's really happening, what's progression of disease, how things are changing, etc. So I started looking into dental x-rays, how to read dental x-rays, what was I really seeing, what was real and what was not. It was an aggressive diagnosis. I did not need all the treatments recommended. So I got many different opinions on those x-rays as well. But what I realized was, in the end, it was the patient, the dentist, it was a better, if they communicated in a better fashion, in a way that things, hey, these are things that we might want to look at, you might want to take them seriously or not. And I think that's where technology can help in general. But for me, I entered into the field with a background in medical imaging. So I was previously working on MRI imaging, and had worked on artificial intelligence lab as well while I was at MIT. So had the background here, but got into dentistry because of a personal experience and not really understanding what was really happening, and wanted it to be more of a science rather than an art, and having it more definitive diagnosis happening, so I could be comfortable in accepting the treatments that were being recommended as well. So definitely something I feel very passionate about, because I was personally impacted and got into it to help improve the care that was being provided.
So you had a personal story as well. And now at MIT, were you studying artificial intelligence, or did you say medical radiology? Is that what you were studying?
So I was at MIT. I didn't do biomedical imaging. That was after I graduated. I worked at a company called QBio, where we worked on MRI data, working on making that more quantitative, faster to acquire, and but, just in general more accessible to everyone. And before that, I was a postdoctoral fellow at Computer Science and Artificial Intelligence Lab at MIT, working on biomedical sensing using machine learning. And before that, I was doing my PhD there as well in autonomous systems. So have a background in AI and biomedical imaging.
Okay. Okay, Blocky. You went to Tulane. Tulane's a good school. Don't worry. You went to MIT. Okay, all right, I can do this. Okay, so so now, would you say artificial intelligence in dentistry? Is it the now? Is it just starting to happen? And what's in store for the future?
Yeah, so it's definitely now, if not yesterday. I know, I'm just kidding, but it's actually definitely now because, not only is the technology there, but also we received our FDA clearance last month for our Overjet Dental Assist product. And that allows us to, that registers this as a software as a medical device. So it can definitely be used in practices. And DSOs have started to adopt this already. So I think if you're somebody listening who wants to provide better care, wants to make more revenue, etc., this is a technology that's can be utilized currently to really improve the protocols that are being followed in practices, identify missed treatment opportunities, and then provide the best patient care that can be provided. And you can, get the software and get it installed in your practice now rather than years from now.
So even like a single office private practice like mine, we can install this, implement this technology in my office as well.
Yes.
So it's not just DSOs; it's really any type of private or any dental clinic out there can implement this.
Yeah. Why I mentioned DSOs is DSOs have been now at the forefront of adopting technology, which is interesting. But of course, they have people looking at ROIs, looking at whether it makes sense, and if it makes an ROI for them, they're adopting the technologies. And I think that's where people in solo or private practices, as well as smaller group practices, in order to leverage this technology, they should be looking at, hey, what's the ROI for me? How does this technology help me in doing my job in a better fashion, making my life easier in a way? And I think that's where having the same kind of mindset is important, and I think whether it's a larger practice or a smaller practice, etc., there's enough opportunity here that can be identified, and for the first time ever, we're actually looking at clinical data. So you've always in dentistry, you've looked at financial data, whether it was production, whether it was your ratios of your hygiene versus restorative. Everybody knows, it should be, or by rule of thumb is it should be 70-30, but where does that 70-30 come from? Is that the right metric for your practice? And you've needed consultants coming in to help assist you in these practices. And I think that's where things are changing now, where you not only can analyze your financial data now, but you can actually analyze your clinical data. And from that clinical data, which stems the financial data as well, but just from that clinical data, you can make better decisions about your practice, as well as the treatment that you're providing.
That's such a good point. If you don't have the analytics, then you don't know where your practice stands. You don't know where to pivot and make changes and how to improve. So that's awesome. Now, so I currently, we have Dentrix and Dexis, but we're switching to CareStack, but keeping Dexis. Would this work with any practice management software? How does that work?
Yeah, so it works with most. I won't say every practice management system, but all the major ones. So Dentrix, EagleSoft, Open Dental, CareStack, Denticon, and some others as well, but mostly the major ones. Uh, so it basically integrates with the practice management system as well as the imaging software, and then analyzes not only the practice data but also the image data to help uncover treatment opportunities as well as treatment protocols, etc., that can be improved.
Yeah, so I have this thing where I called ROI versus ROF, which is return on investment versus return on fun. But I think adding artificial intelligence would be ROC, return on cool. So if you add artificial intelligence to your practice, I think it could be such a great marketing tool as well, where you show it to patients, they're wowed, the staff is wowed, then your patients are going to tell their friends and family that this office uses artificial intelligence. You could start marketing it. So I think it's a great assist for your diagnosis, but also could be great for just your overall brand. So ROC, return on cool.
Yeah, that's interesting point, Eric. Just to add here, the interesting thing is that, for example, when you talk about periodontal disease as a patient, most because you're not feeling the pain there, it's not like a severe throbbing that patients usually associate dental pain with. It's basically something that is hard to even let patients know of how important that is, what this means, etc. Again, you have a few minutes to explain that to a patient. Everybody has different backgrounds, etc. It's not like they're informed in this condition. Most people are not. It's one of those very, very underdiagnosed, very underinformed conditions in general. However, if you had a tool where, for example, using Overjet, we measure every bone level that is and measured in millimeters, and that information is something that you can, as present on the X-rays now, you can say, hey, patient X, you have 3 millimeters. That is and that is bone loss that has occurred over time, and you see the other teeth here in the other area. It's actually below the or 2 to 2.5. That's okay. Here you're seeing some issue that's highlighted in red. Now that communication actually changes, rather than something to do with there is some kind of bone loss, which a disease that people cannot really understand as well as see, in a way that they need to see to get informed to make the decision as well. So I think having a tool where it's these measurements that are especially bone level measurements that are placed on top of the X-ray across all the teeth, etc. as well, and then you can actually see across your past treatments past X-rays as well. And now, if progression is happening, you can point that out to them. But in general, it gives the patient an ability to now have these measurements to understand what this would be, and X is bad, Y is good, kind of making it simplified, or showing it in a simplified manner helps them make better decisions too. So I think one is the fact that these measurements appear, but also for the patient, like now they can understand it better, and then make better decisions for themselves. We do see treatment acceptance rates improving in the practices with the visualizations that are added, especially the measurements on the bone levels.
So does it measure from, for example, the CEJ to the crest of bone, and then you can actually compare, every 6 months, we can show the patient, okay, look, it's getting worse, and they can visibly see that they're losing bone, and then they're more apt to follow through with treatment?
Yeah, so one is there is some slight, because of the angulation of the X-rays itself, so there is some tolerance on the measurements, but the idea here is, if there is it might not be 6 months. The periodontal disease is a little slow, usually in most cases, but say in a year or so, there's a visible difference that's happening. But even before that, like the ability, patient comes in and they have root surface calculus that is again highlighted with bone levels being present, with inflammation that has happened. The data itself is significant for to be able to convey to the patient of their condition. And to your point of, if there is progression happening and that can be measured over time, you can better communicate with the patient itself, where this isn't just a one snapshot that's happening. This is across over time. It's getting worse, and better to treat it before it gets really worse. And now you need a surgery, you need more excessive treatments. But early, you can just do, in the earlier cases, just doing scaling and root planing, doing basic conditions and controlling the disease. And we know that periodontal disease has so many other issues associated with it, with other chronic conditions, etc. And being able to, the inflammation isn't, just in your mouth in general, right? Like that's just a symptom that's happening with the infection that has happened. Being able to communicate better with the patient so that their overall health is better is, I think, very, very necessary, and dentists can play a major role in that.
Now, can it also show visible difference? Like, for example, there's an incipient caries lesion and I want to watch it, and then 6 months later, a year later, it's gone through into the dentin, and now we followed it and there's a difference, and now it's the AI will pick that up, and now it's time to do that filling, for example.
No, absolutely. And say it was like orange is getting more and more red, right? Or it was like, slight yellow and now it's gone in red, right? So definitely worth treating now.
Now, will the software pick up, will it highlight, for example, PA lesions, or like a widened PDL, or cervical burnout? Can it pick up all of these issues?
Yeah, no. So, whether we want to show cervical burnout or not, that's another, question. For us, it's been more of like not confusing cervical burnout as caries lesion, and being able to so it isn't trying to overwhelm the patient or the dentist with just everything. It is about highlighting the important conditions, mostly the conditions that might need some kind of intervention, whether it's preventive intervention or whether it's a treatment, etc. But things that are just there that you might not want to look at, like on the back, kind of, which checking every tool. There's so much information, but the information that we actually display is very cleaned version of it, so that only the relevant information is there. Because again, the fact that the patient is getting educated on a new thing that they didn't know about is a lot already. So keeping it simple, keeping it to the conditions that are very, very necessary to be intervened with.
Yeah, and you only have so much time in that chair to go over all of this with the patient. I found, when I first got out of school, sitting down and reading an FMX was, one of the most time-consuming things. And determining whether a cervical burnout was an actual cavity or not, I really struggled with that early in my career. And then also communicating with the patient. Now, I've done my 10,000 hours and I can communicate with patients much better. My patients trust me and they usually go along with all the treatment I recommend. But early in my career, that wasn't the case. So having a software that can help you, I think is great. Now, how does this work with like third party, let's say like insurance companies and reimbursement? Does artificial intelligence help with that as well?
Yeah, so the cool thing is that we have been working with insurance companies to help streamline their operations, which is one of the most common things that is done is review of treatments in determining medical necessity. So how an insurance company pays out for claims is that they actually determine whether it was a medically necessary treatment or not, especially when it comes to major procedures such as crowns, core buildups, or extractions, etc. And here, the way they currently do it is they do a manual review. They are a team of dentists that are hired on the insurance side to review these claims, determining medical necessity. And of course, that is, they have limited information with which they're determining it, and not everything gets reviewed. So what ends up happening is that you might submit a crown, it might get accepted. A similar crown might get rejected, and now you're all confused on what's really happening. Why is insurance company accepting or denying it? It might be that there was a subjective decision that happened. However, most likely one got reviewed and the other one did not, and both did not meet the criteria. So having an ability where when claim gets reviewed, there's an objective decision happening. It isn't one subjective decision against another subjective decision. Knowing that the actual criteria of it was followed, and being able to make those determinations in such a way that it's consistent. So, when a condition, when a treatment does not get accepted by the insurance company, anytime a similar X-ray is submitted, it should not get accepted, or the other way around. When it gets accepted, every time an X-ray like that is submitted, it should get accepted as well. So having that consistency is very important. And but what that allows us to do is, now we're working with some of the largest payers. We have 5 of the 10 top dental insurance companies that are utilizing the technology, and that allows us to do so much more. This is, I would say, just the beginning. One of the things that we're working with with the major carriers is allowing real time point of care pre-adjudication. So while the patient is in the chair, being able to make that determination for them rather than after the fact. 2 weeks have gone, now you're submitting something, it gets rejected. In the end, it's the patient who loses. And the idea here is, and for the dentist as well, right? Being able to have knowledge of that in real time. So if more information is needed, they can provide more information at that time rather than waiting for 2 weeks for a determination to happen. So that's something that we're very, very excited about, and being able to enable that. We believe it's going to be a game changer for the patient experience, as well as a lot of providers are very, very interested in it as well, in being able to get some of the, because most of the time things just get accepted, right? Like the things that get it's actually very, very low, much lower than people realize how low these denials are of benefits. However, everybody has to wait many, many weeks for results to happen because they have to go through this particular process. So being able to streamline it, to make it more efficient, to make it fast, to make it and completely change it the same way that you've had it in, say, for when you go to the pharmacy, there is point of care adjudication that happens on your benefits, and similarly can happen in the dental clinic as well.
Wow, that would be such a game changer for real-time determination, because it's such a waste of time for the staff hours that we spend on verification and determination, and then the waiting, and a lot of the patients, they just want to get the treatment done, but it's just it's such a waste of time waiting for determination. So if we could get that real-time determination, submit the X-ray, and have the insurance company tell us right away that this treatment is approved, then we could do a lot more same-day treatment, and it's better for us, better for the patient. I think that's such a game changer. Wow. So now, speaking of that, what else is in the store in the future for Overjet and artificial intelligence?
No, so I think the way we look at it, we're just getting started, right? The first thing is being able to read clinical data, which has never been able to be read before because it has been in a format the computers have never been able to analyze it. However, once we can analyze the data, we can do so much with it. We talked a little bit about how do you look at progression of disease. That's very, very important for us. The other is risk. How do you actually measure risk automatically, not by these methods which are so slow and no dentist will actually utilize because it just, again, in the environment they work in, it just does not work for them to go and collect all that information, etc. Being able to automatically determine risk for the patients is, I believe, very, very, very important. And then looking at more personalized care as well, personalized plans. A patient where progression of disease is happening much faster, you might not want to be on even like a 6-month recall. You might want to be do it much faster. So having, especially we have seen when patients have dry mouth, for example, that really speeds up the progression of disease that's happening. Having the same kind of plan, so we'll be having more evolved plans as well, so that they can better support the patient needs, and then having again, looking at the patient not as a one snapshot, but looking at their entire dental history is very important to us as well. And lastly, what we're trying to accomplish is trying to bridge that gap between oral health and overall health. Being able to, we know that your mouth is your gateway to your body. Your mouth is not separated from the rest of the body, and being able to treat it as such and really give importance to the conditions that are present and are manifesting in the mouth, but resulting in a lot of other issues for the patients as well. I think that's our next thing that we're focused on, trying to push for and make sure that the care is being provided, which is in the best interest of the patient. And then dentists and dental professionals are equipped to provide that the best care in the best possible manner, which is not overburdening to them, but in a way makes their life easier. And then they can use this technology to support them in providing the best care as well. So a lot to be done. We're just getting started.
Wow. It sounds like it's just the beginning. So again, Warda, thank you so much for joining us. Warda Inam, CEO of Overjet, and you can go to dealsfordentists.com, and their offer is a 10% discount for anyone wanting to use Overjet Dental Assist. And Warda, before we wrap things up, any last words of advice for dental professionals or young entrepreneurs out there?
Just in general, like for the way I look at it is, technology is here to help us utilize the more technology that we can utilize to make our life easier, whether that might be a calendar app that you install, or some tracking for your health, or a meditation app, etc. Using these technologies and tools that are available to us now at our fingertips, as such a AI for a dental practice even, can really make a difference, and not waiting on like everybody else to be adopting it. I think there is an opportunity here to be at the forefront of technology, leverage technology in such a way that you can actually make your life easier and achieve more that you think you could. And I think for me in general, that's I would say something that if somebody can take away today would be, technology is here to help, and the best we can utilize technology to help us, the more we can achieve as well.
Awesome. Warda, thank you so much. That was such a great interview. Let's be in touch.
Thank you, Eric. Hope you have a great day.
You too. Take care.